Thank you. You know, each year, up until the last, Chris Brunswick, a member of the NBCC board and its vice president, opened our annual summit. This year, we dedicate the inaugural Leadership Summit to her memory and her life. It's so difficult to believe she's gone. She was my very close friend and confidant, my travel buddy, my playmate, and an incredible breast cancer activist. You know, Chris had a full-time job as executive director of the tax section of the ABA, and she gave so much of her time to ending breast cancer. She testified before Congress on our behalf. She sat on committees at the Institute of Medicine, the Department of Defense, various research institutions. She led teams of advocates on Capitol Hill for us. She knew and she cherished grassroots power. She was our international representative, traveling to a number of continents, speaking our message. She helped mentor emerging leaders. She was a media spokesperson for us, and no issue was too controversial for her to speak out on our behalf. So many times I remember seeing her on television as the lone voice on our side of an issue, but she had the intelligence, the grace, and the courage to stand up for all of them. Her ability to strategize, to relate to every type of person, to care deeply about all of them, her strength, her commitment to having fun in pretty much every circumstance, her love of living as big and as much as possible, and her gold medal-worthy shopping expertise are all of the things that we will remember about Chris. Now, we're going to celebrate her life tonight here at the summit at 6:30. But now I ask you to join me in saying thank you for all she did for us as we dedicate this event to Chris Brunswick, and join me in applauding her life. Thank you. So this year, I welcome you to the inaugural Leadership Summit of the National Breast Cancer Coalition. Many of you knew Chris, and I know cherish her and cherish her memory. She died in February after a courageous battle with breast and cervical cancer, but we're going to fight on in her memory. We have to stop doing this. I mean, we just have to do this too many times. Now, I'm a 25-year breast cancer survivor. I'm thrilled to see you here at the inaugural Leadership Summit. We've been around as an organization for more than 20 years, and we have the courage to change. And that is not at all easy. I am grateful that you are willing to be a part of that change. For those of you who have been to our many meetings in the past, our advocacy training conferences, you're used to being in a ballroom this weekend of the year with about 800 other advocates. This is change. We've been training for 20 plus years, and we will continue to train. Project Lead, our online advocacy training, our webinars, other avenues for training. But you may have heard that we set a deadline, and it's impossible to achieve that goal without real, courageous, educated leadership, without the willingness and ability to pull yourself out of the status quo of what you've been doing for years to embrace new challenges, to be uncomfortable. So it's time to build to the next level after 20 years of training. It's about leadership now. A vital part of Breast Cancer Deadline 2020, leadership. Now, this deadline campaign is built upon a foundation of leadership, leaders from many different fields and walks of life. And that's what this inaugural Advocate Leadership Summer is all about. We invited women and men across the country and around the world who want to be leaders for Breast Cancer Deadline 2020 to attend. We ask those of you who care about ending breast cancer to go beyond what you've done in the past and make a larger commitment to the cause. And all of you stepped up to say, I want to be that leader. And in fact, you've demonstrated your leadership in many ways already. You've spread the word about the deadline in your communities and worked to change the conversation about breast cancer. You've raised money to support Breast Cancer Deadline campaign. Many of you have gone through our training programs. Some of you are team leaders, field coordinators, board members, emerging leaders. All of you are playing a leadership role in ending breast cancer. T.K. James, a young man from Georgia whose family has been affected by breast cancer, has stepped up to become such a leader. He registered for the summit, and in 72 hours, he raised over $1,000 from 19 donors, and he didn't stop there. He planned a car wash to raise more money to support Breast Cancer Deadline 2020. People like TK from coast to coast, from Canada and Trinidad, and as far away as Nigeria and South Africa, heeded the call. That is leadership. Now, NBCC has a long history of being a leader in the world of breast cancer, taking on big issues, challenging business as usual, facing controversy head-on, and achieving success. Indeed, in many ways, the history of NBCC has been about doing what everyone else says is impossible. Now, for those of you who are new to us, let me tell you some stories. For those of you who are here for the 21st year, I apologize for your having to hear them again. Now, I vividly recall my introduction to the National Breast Cancer Coalition. That was in 1991, 3 years after my diagnosis of breast cancer at age 39 with a 14-month-old son. I was a partner in a law firm and a community volunteer. A small group of women invited organizations from across the country to Washington, D.C. to hear about an idea, a coalition of organizations to focus on political activism, to change the systems of breast cancer research and access to care, to figure out how we could influence all the areas that affect breast cancer, to become breast cancer activists, to go beyond awareness and mammography to actually end the disease. At the time, there was no advocacy arm in breast cancer and no organization interested in taking on this controversial and challenging role. To be effective, these women knew they needed to pull together diverse interests and perspectives from all kinds of organizations concerned about breast cancer. A national coalition was needed, a coalition that focused exclusively on action and advocacy to end breast cancer, and a movement was born. Now, there were many skeptics at the time. Coalitions, they're notoriously ephemeral. How could so many competing interests ever stay united? Keeping that coalition together was hard. It was frustrating. It was difficult work. But 20+ years later, we continue to thrive, defying conventional wisdom. The women I met in that room in 1991 were not content with simply talking about what needs to be done. They carried that talk into action, and they launched this amazing revolution that is the National Breast Cancer Coalition. Again and again, we have identified challenges, done our research, collaborated with creative thinkers, and then developed innovative solutions. Invariably, that solution was dismissed by others, even ridiculed and deemed impossible. And then we would do it anyway. Like when NBCC member Jan Eich-Swikert recognized that the CDC program to screen low-income and uninsured women with breast and cervical cancer did not have a treatment arm. She pointed out that giving free screening but no treatment was cruel and unfair. She brought that issue to NBCC, and we took it on. We developed legislation for the CDC Breast and Cervical Treatment Act that is now the law of the land. Others fought us on that, opposed that legislation, said it could not be done, but we were not swayed, and we won. Now, those women back in that room in 1991 were not a part of NBCC to cure their own breast cancer. It wasn't about them. They launched and nurtured this movement for their daughters, their granddaughters, their sons, for future generations. And it is for those future generations that 2.5 years ago, we launched Breast Cancer Deadline 2020. And we will know how to end breast cancer by January 1, 2020. But I want to take a moment to acknowledge some of those incredible leaders who launched this movement and brought it alive. Those leaders who died of breast cancer but fought for our mission to end it. Those whose commitment and actions helped bring about this deadline campaign. Pam Onder, who told Congress how it was, not how they like to think it is. Pat Barr, the powerful political strategist who led the '93 effort resulting in the National Action Plan on breast cancer. Kendra McCarthy, who helped plan our 2.6 million signature petition drive. Ginny Sofa, who conceived of our photographic exhibit, The Face of Breast Cancer. Annette Drummond, a founding member of NBCC, who fought to change research and access for breast cancer in her home state of Maryland and on the national stage, who in the beginning did our books on her PC in her home. What leaders they were. Others through the years have embodied that same strength and tenacity that is so clearly associated with NBCC leaders, and we cherish their memory. Karen Noss, Jean Powers, Marsha Pretsky, Ronnie Rosenberg, Becky Morris, Martina Correa, Kathleen Livingston, Kathy Zeitz, Carolina Hinestrosa, Linda Croucher, Chris Brunswick. Too many more. All of them stellar examples of real leadership. We celebrate their lives and we fight on in their memory. Now, a deadline changes everything. You understand that. It must change everything. For that is the reasoning behind the deadline. We cannot afford any more years of the status quo. Because we know that despite all the years of fundraising and raised awareness and screening programs and incredible investments in research, we are nowhere near where we should be in terms of preventing breast cancer and preventing deaths from it. We have seen some progress. We've extended life for some women with metastatic disease. Mortality rates have declined, but nowhere near commensurate with the investment we have put into this issue. Breast cancer remains the second leading cause of death, cancer death for women in the US, and the leading cause for women globally. In 1991 in the United States, 119 women died every day of breast cancer. 20 plus years later, and billions of private and research dollars, that number is 108 every day. One death every 14 minutes. This year, nearly 40,000 women and roughly 400 men will die of breast cancer in this country alone, more than 10 times that number worldwide. And by 2030, it's estimated that globally, more than 730,000 women will die of breast cancer. That should not be considered success or even meaningful progress by anyone's standards. And this is an important fact. The incidence of women diagnosed with advanced breast cancer has not changed. Rates of diagnosis of truly lethal disease has remained stable since 1975. All of these reasons are why we launched Breast Cancer Deadline 2020. Now, we could just continue along supporting the business of breast cancer. Maybe some could do that. But what would we accomplish by doing that? More people would like us. We would be in a pink zone of comfort. Scientists would be happy. We'd be getting them more money, but we wouldn't be pushing them to do something different. But you know what? We have to end our addiction to comfortable, to easy, to good enough. We have to be leaders, true leaders. That means all of us who want to play a role in this campaign have to find the will, the strength, and the belief to do what it takes to achieve the end of breast cancer. Leadership is taking risks. It's going farther than you've gone before. It's putting something greater ahead of your own personal concerns. Taking on the business of breast cancer, challenging the status quo, solving meaningful controversy, pushing the field. You're here because you understand that. But it's not just about the 4 days in DC. You have to bring this deadline back to your communities, back to every place you talk about breast cancer. Raise your voice, raise your hand, raise awareness of the need to end breast cancer. Speak up and speak out. It's time for this to happen. Julianne Moore is a 2-time breast cancer survivor from Louisiana, and she will celebrate her 88th birthday this fall. Julia came to last year's summit, and she returned to Louisiana inspired and driven by the deadline. She personally took on the challenge of identifying organizations in her home state to endorse the deadline. She motivated her peers to reach the statewide goal for our petition to urge the president to play a leadership role in ending breast cancer. And she's back this year. That is leadership. In 2013, our efforts for Breast Cancer Deadline are focused on building leadership at all levels and among all stakeholders. The significant investments in research over the years have brought us to the point where a collaborative, deadline-driven mission approach is viable. We need to look critically at research and healthcare priorities and incentives, and to look very critically at advocacy efforts. You know, we've heard from many invested in the business of breast cancer that we cannot achieve our goal. They tell us discovery doesn't answer to deadlines. I mean, what does that even mean, really? Discovery science is important. I want to stress that. It is important. But at some point, some of that discovery has to result in benefit to people. Discovery has to be applied to save lives. It isn't just a never-ending quest for knowledge. It's about people's lives. So discovery doesn't answer to deadlines? Well, it has to answer to us. What are they afraid of? We're bringing them together to do something that's never been attempted. But examples of success in other fields suggest that it's often the lack of vision, willpower, accountability, and leadership, not the level of knowledge or the science itself that stymies progress. How did we put a man on the moon? History tells us that the focus was a sense of urgency, a commitment of resources, a multifaceted management with a singular focus, and accountability with a very public deadline. Deadlines can make the impossible possible. Putting that man on the moon was impossible. Curing polio was impossible. Eradicating smallpox was impossible. Getting defense dollars to fund breast cancer research was impossible. Well, what seems unimaginable can become reality with a deadline, strong leadership, strategic vision, and a culture of innovation. These ingredients are available to us right now, and now is the time to act. We can't do it alone. NBCC can point the way, create and facilitate collaborations, formulate and implement plans of action, identify and push for policies needed. But first we have to understand that we are able to launch the Deadline campaign because of all we have accomplished over the past 20 years. Our advocacy brought about more than $2.8 billion to science, and many tools, knowledge, and technology resulted. Our advocacy brought about the expansion of access to care for thousands of underserved women, and a system of health care was expanded. Our advocacy created unprecedented training programs to give us, advocates, the knowledge and the tools to act as partners and collaborators with researchers, to set research priorities, identify important questions, design research itself. We made breast cancer a political issue in the best sense of the term. We, advocates, set a policy agenda and then worked to make it a reality. That is the base that we built, but it is not enough. So we've taken our leadership and our work to an entirely new level. We not only set a deadline, we developed a blueprint on how to achieve it. We analyzed what role the government should play in the deadline, and then we designed legislation to make certain our government takes on that role. With your help, we got broad bipartisan support for that bill during the last Congress, and on Tuesday, you'll be meeting with members of Congress to get them to renew their support for the Accelerating the End of Breast Cancer Act. In science, we designed research projects, created collaborations, identified the people to bring together and the questions to be asked, and then asked the scientists to work within our framework. In the Artemis Project over the past couple of years, we've created a dynamic process that will lead to the answer of whether we can have a preventive vaccine and what we need to know about tumor dormancy. We expanded the group of people working on the preventive vaccine project. We held meetings with multiple groups of stakeholders to examine specific issues, such as immunology. We developed and launched information sharing tools so that all involved can continue to collaborate virtually throughout the year. And through the generosity of the National Philanthropic Trust, we have funded seed grants totaling $400,000 with plans for another $1 million to be granted this year. We brought groups of advocates together to address scientific questions and maintained an infrastructure for collaboration so that under our leadership, the project could flourish. But this work was not just about a preventive vaccine. It was about creating a new model of science that truly put the patient, trained patients who are advocates like you, at the center and at the head. And that model is now being applied to other issues in preventing metastasis and in primary prevention. Next month, for example, we will convene the first meeting of the Artemis Project on tumor dormancy. We've launched outreach projects. We've expanded our Center for Advocacy Training to include online training to change the conversation in breast cancer. So the goal of ending the disease is the context within which everything happens. Ultimately, though, success will depend upon those outside NBCC. Leaders in industry and government, researchers, the advocacy community, all of you to do its part. Now, many researchers want to work with us on the deadline. I've heard the scientists who attend our summits, who work on the Artemis Project with us, say their involvement in this unique approach helps them think differently about their work. They've formed new collaborations that will get answers more quickly. They recognize that through the work of Breast Cancer Deadline 2020, they are able to participate in something that has been missing in breast cancer research, a true collaboration that rises above individual agendas to focus on the big picture of what is happening and what is needed, with a focus of ending breast cancer. Not a focus on an individual's work or the next publication or grant, but rather a focus on the real goal of saving lives. Let me tell you about one of these researchers. Danny Duke is the chief of Human Immunology section at the National Institutes of Health. He studies the immune system's role in disease with the goal of finding new therapeutics and vaccine approaches. and much of his work has been in the area of HIV. We invited Danny to one of our Artemis Project vaccine meetings, and he told his colleagues that the only reason he was going to the meeting was to tell us we couldn't do what we wanted. A vaccine for breast cancer wouldn't work. But an odd thing happened. He listened to what was happening around him, and he became enthusiastic. He signed on. He even did some analysis in his own lab for free. He presented those results at our March annual meeting. He partnered with Kim Lyerly to analyze DCIS samples and was able to demonstrate finding immune cells within those samples. Now, he came up to me at our March meeting to tell me this story, and he said, "You know, I think this just might work. And you know what? I am really excited to be a part of it. So thank you for including me." See, that's the kind of change we need in the scientific community. It won't work, so it just might, and I'm thrilled to be doing this with you. That's leadership. And we need more leaders like Tom Harkin. Shortly after NBCC's formation, we knew the government had to spend more money on breast cancer research. We did it the NBCC way. We did our homework. We figured out how much science could spend well that year because we didn't want to just throw money at the problem. We lobbied for that amount. We began our work on Capitol Hill to get $300 million more appropriated. And we turned to Senator Harkin and worked with him on an amendment in the Defense Department budget to begin the DoD breast cancer research program. That amendment passed, and overnight it doubled federal funding for breast cancer research because of our leadership, our willingness to challenge business as usual, and because of his leadership. Let's talk about the next few days, about expanding your roles as leaders in ending breast cancer. As we work to mobilize the entire breast cancer community, one effort in that direction is the convening of this smaller, targeted leadership summit. This meeting is going to be a unique experience. Attendance was capped to allow for a setting that will facilitate small group interaction with researchers and thought leaders. All of this was change, and asking you to fundraise was new as well. That is not something NBCC has done over the years, but the deadline truly does change everything. We cannot continue to do what we have been doing and assume it will somehow end breast cancer. We need to start with that goal and then figure out how to get there. Blank slate. What do we need to do to make it happen? And then do it so that we can succeed. The deadline changes everything. You've been with us, many of you, for so long, and you've helped us accomplish so much. But our greatest achievement is yet to come, and we cannot do it without your support. At this inaugural Leadership Summit, you'll have the opportunity to connect with leaders in the fields of medicine, politics, communications, and more. You'll collaborate and develop plans with other advocate leaders, and this is going to be a tremendous opportunity for all of us. Through the plenary sessions tomorrow and Monday, you will hear from leaders in research. They're going to address areas that are the focus of Breast Cancer Deadline 2020, primary prevention and stopping deaths from metastasis. You'll learn more about the challenges in breast cancer today and how they impact diagnosis, treatment, and access across the globe. Leaders from the political world will challenge us to think about how we can more effectively deliver our message to the public and to political leaders. During the workshops, you will gain leadership skills in tactical areas such as research advocacy, lobbying, social activism, and public speaking. And each day there will be speaker meetups where you will have the opportunity to interact with our incredible speakers in smaller settings, to challenge one another to find new ways to lead in our effort to end breast cancer. And finally, you're going to collaborate and network with each other. as you develop your own personal action plans for being a breast cancer deadline leader in the year ahead. That learning from one another will begin this evening as some of the attendees share their best practices with you from this stage and in more detail through posters during the reception that follows, and you will hear from some of our leaders. Now, what about us, about the advocacy community? Because we need to change. More of the same will not produce different results. All of those at risk, all who care about them, must join this revolutionary activist movement with the goal of ending breast cancer. It requires this movement, this deadline campaign, this mission to end breast cancer, requires the involvement and leadership of educated, committed breast cancer advocates. You are all going to play a major role in this campaign. We must all look for and take advantage of every opportunity to blog, to write letters to the editor, to be on local television and radio. If it's a free handout newspaper in your community, or if it's major media, connect everything in breast cancer to the deadline. We will be working with you and your colleagues to give you the tools to do that, to develop networks regionally of support and advocacy in your communities. We're not just looking at this on a state-by-state level. We're expanding our activities with our emerging leaders on college campuses, among young adults in general. Our international Project LEAD graduates and others across the globe will work with us to mobilize communities worldwide. In order to reach the deadline goal, the campaign must continue to gain support from a diversity of groups and organizations, not just those focused on breast cancer, but all who care about and understand the importance of this issue. Since the launch of the deadline campaign, more than 250 organizations have endorsed the campaign, and that number continues to grow. This expanding list demonstrates the breadth and diversity of breast cancer, women's health, and healthcare advocacy community that stands behind the deadline. We need you to get more organizations to endorse it. Many of our member groups focus on extremely important specific issues: young survival, HER2, metastatic disease, triple negative, disparities, and they should. But we must all come together to work on the overarching issues in breast cancer, on the strategy to end breast cancer for all of us. We can achieve that mission with the right planning, passion, leadership, and funding. You all know at the current rate of progress, it could be centuries before the end of breast cancer, but we can and we will achieve our deadline. Jonas Salk joined as head of the Virus Research Lab to find a cure for polio in 1948. A vaccine was announced to the world 7 years later. On May 25, 1961, President Kennedy announced the goal of placing a man on the moon, and Neil Armstrong set foot on the moon 8 years and 2 months later. The tools, the information, the resources, and wisdom existed to achieve those goals, and they exist now to create a global strategy to end breast cancer. Now, we hear from others that those things are different from ending breast cancer. Well, you know what? Polio is different from the moon. The differences do not matter in this context. It's been more than 20 years since NBCC was founded in 1991 with a mission to end breast cancer. Are we close? Well, we're nowhere near close enough. Has there been progress? Of course, but not enough. With your help, we have the opportunity to make history. It will take all of us working together to change years of incremental progress and inspire a decade of unparalleled achievement. Is it going to be challenging? Absolutely. Is it going to be controversial? Oh yes, we've already seen that. This is going to be one of the most difficult things any of us has undertaken, but that's how it should be. Will others disapprove? Yes, we've seen that too. We've seen censure for our willingness to push the status quo in entirely new directions. Will this work that we're doing make others rooted and invested in the status quo angry? Yes. Should that stop us? No. Remember, moral courage is the one essential, vital quality needed to change the world of breast cancer, and NBCC advocates have moral courage to spare. We want to see an end to breast cancer. It's time. The deadline is a lifeline for all of us who care about breast cancer, who care about those who have it and those at risk. Our mothers, our sisters, our daughters, our sons, our friends, our lovers, the next generation, all of us, the end of breast cancer. It's time. It's time to lead. It's time to end breast cancer once and for all. Thank you.